Time for that health checkup. We are talking AI and healthcare. Our next session is titled Just What the Doctor Ordered, with a distinct question mark. And to try and answer this question, we have with us Dr. Jayananthan Ram, Dr. Sushmita Roy Chaudhary, and Oyanavu Devgupta in conversation again with Priyank. Quick introductions. Dr. Jayananthan Ram is a child and adolescent psychiatrist now working in Kolkata for more than 20 years. He spent a decade in the UK prior to coming back to India, a decision taken, he says, after watching a Bollywood film on a cold and bleak winter evening in Yorkshire. He works extensively with schools, community organizations working with children and young people, apart from working individually with young people and families. Dr. Sushmita Roy Chaudhary, a pulmonologist with 25 years of experience as a physician, completed her MBBS in 1997. She then pursued her MD in tuberculosis and respiratory diseases. She was awarded the European Diploma in Adult Respiratory Medicine in 2011 at Amsterdam, and she became a Fellow of the Royal College of Physicians, Edinburgh, FRCP, in July 2022. She is presently the Director of Pulmonology at Fortis Hospitals. Oyanavu Devgupta, our third panelist for the day, co-founded America Group of Hospitals, which over the last decade has grown to become the largest healthcare network in East India through its 10 healthcare facilities. He was with Narayana Health for half a decade before this, as an active member of industry bodies like the CII, FICCI, ICC, and PCC, and I, that's a lot of C's and a lot of I's, and AHA. He has been working to promote entrepreneurship and to strengthen policy development. Priyank, of course, is Priyank, part of the core team of All Cap Communications and a journalist writing for Michael Kata. Over to Priyank.
Good afternoon. Fortunately or unfortunately, AI isn't yet equipped to moderate, so you're stuck with me for another session. Now, over the years, the human being has been celebrated as the greatest creation of nature. But today, artificial intelligence is being increasingly celebrated as the greatest creation of humanity. We are living in a world where algorithms meet stethoscopes, where DNA and data, where bytes and biometrics are inseparably interlinked. A world where we can have caregivers potentially speak in any language and voice of our choice. The modern elixirs are not chemical compounds, but magical concoctions of zeros and ones. In this context, is artificial intelligence going to create a world of seamless healthcare? Or is the over-reliance on technology going to be the next pandemic? To discuss all this and more, it's a pleasure to be a part of this session on AI and healthcare. Before we really get into the specifics of what these three illustrious individuals can tell us about, I would want a brief overview from the panel in terms of the history of collaboration between AI, medicine, and healthcare, because healthcare has been a very early adopter of AI, also an enduring adopter of AI. So maybe if we could start with you and then quickly go through the panel in terms of a quick note on the history of collaboration.
So AI is something futuristic and probably what's happening today, but for us to appreciate what's going to be in the future, it's so important to know where you come from. The past is even more relevant, and probably that's why we all read history in our schools even now, and that puts in the perspective. So I'll just give you a bit of perspective where we started off in our country, and during independence, when we 1947, the average lifespan of our country was about 40 to 45 years of age. And today we have about 70 plus years of age. That's a significant journey covered since where we were in those days. But one problem that has remained since then till today, this is my 25th year in healthcare, and I've been talking about this every single forum that I've been to. The two things that healthcare works around is accessibility and affordability. These are the two wheels around which you can do the entire story of healthcare. And when we talk of accessibility, one is to understand that healthcare is being delivered at multiple levels, primary, secondary, and tertiary. If you add up, a majority, almost 80% to 85% of healthcare happens in urban areas. Even if healthcare is available is it affordable today? How many people can actually afford healthcare the way it is supposed to be? There is questions around universalization of healthcare, which is a global issue today. What's the private sector's role, what's the government's role? If we leave all that aside, does technology play a role in AI plays a role in bringing healthcare costs down? I think that's something which we should look at and see if these three parameters is where I would like to bring in and discuss as we move forward.
You just asked about the history, I think. And as far as we are concerned, at least for the last 20 years, in some form or the other, doctors, nurses, and healthcare administrators have been using it. 1955 or 56 was when it was first talked about, but about 1971 was the time when the first one was used on an internist. Go back and read it if you find time. It's a really interesting bit. So they brought out the first AI healthcare app, which basically did the job of a junior doctor. If any of you have friends who are studying medicine, you'll know all they complain about is the amount of writing they have to do about a patient. And that is what the internist app helped them do. Write down what was wrong with the patient, what were the findings, and was that leading to a diagnosis. And everyone thought AI was to make the doctor's job easy. But since then, we found it's not just that, it's helped in choosing antibiotics, trying to maintain electronic records of patients, and it's still in a lot of evolution, so much so that recently they've brought out that by looking at one echocardiogram, you can actually tell if the patient is going to have heart failure or not. So it's all in an evolution process, and in the last 20 years, things are going from better to even better. And that's how it is at the moment.
I think AI has been in use for many, many years, and we are all using it. All of you are also using it, maybe without knowing that it is AI. Apple Watch, Fitbits, everything. Now, I think this whole issue of AI, when you talk about it, there is a sense of dread that something demonic is going to happen and it is going to take away jobs and stuff. So I think we need to understand how AI interfaces with medicine and then how we can use it to our advantage and how we actually are using it without knowing it. So what AI does, it simply analyzes humongous amounts of data set so that we human beings don't have to do it, and uses that culled information for the betterment of medicine. So how can AI use, how is AI being used in the current context? It is used in numerous contexts, but if we look back historically, one of the earliest things was using AI in radio imaging. So we have 5 million X-rays of the chest. And as Mr. Devgupta was saying, suppose you are a villager in Arambagh. Chest X-ray has been taken, but there is no radiologist to interpret that. Now, AI has got 5 million chest X-rays where they have compared with the normal chest X-ray, and they can then decide, the AI will tell you that yes, this is a problematic X-ray, this is a normal X-ray, and my gut feeling is that this is tuberculosis in contrast to heart failure. So AI is being used to very, very large extent in reaching out to people, reaching out services where human resources are scarce. And there are millions such examples in medicine. One of the best examples is something called the Human Genome Project, where all of us have 24 chromosomes, all of us have about 40 to 50,000 genes, and these genes are made up of millions of kilobytes of DNAs. Now, over 13 years, from 1990 to 2003, the entire gene mapping of the human beings were completed. It took 13 years then. It is projected it would have taken 5 years now with the supercomputers. And now, once we know the human genome, and so what AI has helped us to do is to choose that my genetic architecture is different from your genetic architecture. And people with your genetic architecture has responded to antibiotic A. So rather than giving you antibiotic B, I will give Prion antibiotic A. Now this wouldn't have been possible through human brain. So therefore, I think the potentials are enormous, and we will see increasingly much more use of AI.
Question to Dr. Ram Samran. Will we be reading minds too? Through AI at some point of time later.
Before we get into the specifics, all three of you mentioned that AI is being used to analyze so much data, give so many recommendations, perform different kinds of suggestions. What is the level of accuracy? And is that level of accuracy considerably higher than what humans can provide at the moment?
So it's still work in progress, because what does the computer do? What it is taught, and what is it taught? It's all deep learning methods and many algorithm-based methods that are taught. So only recently we were doing a project with IIT Kharagpur. So what was that? So there is a disease called interstitial lung disease, where the lung starts to fibrose and becomes gritty and can't make enough oxygen. But there are different types of diseases that causes it. And to recognize which type of disease is actually causing the fibrosis can then predict if that patient is going to get better with treatment or not. So that prediction done on CT scans by AI versus a doctor who's seen it was done. And it was found that the algorithm that was made was pretty good. So that a doctor sitting in diagnosis versus the AI model diagnosing it was more or less accurate. So it is all algorithm based. So it will still have to be taken with a pinch of salt, number one. And number two, lots and lots of more evolution needs to be said before saying that yes, AI is as good as creative intelligence plus AI.
I'm just, sorry, Dr. After. Please.
There is this, see, in medicine, apart from intelligence, you use wisdom. And the word is artificial intelligence. It cannot replace the wisdom which Sushmita has. And I think that is a distinction we need to make. So artificial intelligence is artificial intelligence. It is not the wisdom which she has gained looking at 30,000 X-rays, 50,000 X-rays. So artificial intelligence cannot replace human wisdom, which actually is required when you are at the bedside or at the OT table deciding whether to put your knife in or the knife not to put your knife in. So I think this distinction between intelligence and wisdom will always stand true in whichever field AI is being used.
No, very true. I was just going to give you a small story. This dates back to late 1990s, early 2000, when we were in a village in Karnataka, and we were trying to set up something called telemedicine unit. Karnataka those days was part of Dr. Devi Shetty's founding team for Asia Foundation, Narayan Hridayalaya. It actually started even before that. We were visiting Bangladesh. You would all have heard of Professor Yunus, the economist who was into microinsurance, and he took us to show around his, the villages where the entrepreneurs were. And one thing he came up with after the visit was the only one reason people can't pay back my loans whenever that happens is because they fall ill. And they fall ill, they spend all their money to actually seek healthcare. And at the end of the day, neither they can, most of them don't get cured, and even if they do, they can't pay back the interest that has accumulated over the years. So the idea came up is, can we have a health cover, the insurance model, around these poor farmers who could then survive the illness and retain the enterprise and pay back the money. it didn't happen in Bangladesh for whatever reasons, but that idea was brought to India, and eventually that was the Yashaswini Health Insurance Scheme, which came up with the cooperative societies of Karnataka, where about 50,000 people started off, eventually with 25 lakh farmers who could pay about 5 rupees of a premium and access healthcare. But the problem was, where do you go to access? And India is a large country, like I said. Karnataka had 27 districts. But people had to come to Bangalore in the case of a heart attack or a stroke. And there was nothing in the districts to safeguard. So that's when the idea came up, can we do something where we can deliver healthcare at the grassroots? Mr. Kasturi Rangan used to be the ISRO chairperson, and he said, all right, I'm going to give you satellite connectivity. Can you do something about it? Fair enough, that we used it. So technology was there were healthcare facilities in the government. You have district hospitals, we had sub-district hospitals. You had GE Philips who came forward to give us ECG machines and diagnostics. But then finally, the problem was with all this technology available, there were no people to interpret the ECGs. The problem was when somebody had a cardiac arrest in a district of Chamarajanagar, 6.5 hours away from Bangalore, nobody was there to read the ECG. So a lot of people would be given an antacid, sent home, and they would die in their sleep. Or they would have to travel to Bangalore, 6 hours away. And on the way, your cardiac damage is done for good. So then what we try to do is kind of train the local doctors on basic protocolized medicine, on step-by-step approach to save a life, for which you don't need to be a cardiologist. Less than 1% of the time you actually need a cardiac intervention, a primary angioplasty. It's a very rare thing to happen. But then, this was 20 years back. 25 years hence, has India revolutionized telemedicine? We haven't. Probably, I still feel we did much better work then than we're doing today in actually delivering critical care. Yes, after COVID, suddenly we have a lot of teleconsults happening, but that's consultation. We're still not delivering critical care at the doorsteps in the rural areas, and we will never have enough human resource, not in our lifetimes, to have enough doctors. Even if you have the numbers, nobody's going to go and stay in the villages. There is no alternative. Had that been happening now, if we had the AI that we're hearing today, we would actually be able to interpret that ECG or protocolized medicine. We don't need a doctor to do it all the time. The technology would be ready for that. They would detect that it's a cardiac episode or not, reading the ECG, it's real time anywhere, and actually start treatment protocols at the doorstep. So this is the power of AI that we're talking about in delivering healthcare at the rural areas, and that's how you can transcend geographical barriers in healthcare today. And that's very, very powerful to me.
Let's do a deep dive into the specific fields in which all three of you share your expertise. Let's start with Dr. Ram, talking about AI and mental health. Now, we all know that we're still very much in a country where there's a lot of stigma and reluctance with respect to mental health, especially with going to therapy, especially if I may add, with respect to men. I mean, my friend the other day was telling me that a lot of women end up going to therapy in this country because men don't. But if I asked you, how can AI change that? Because number one, we are seeing the emergence of apps, we are seeing the emergence of AI therapists, which at one level can perhaps make patients feel more comfortable, but at another level, there is no emotional connect with an AI. So how do you see AI and mental health?
I think it is hugely used since the pandemic, and very interestingly, a lot of the Indian cricketers have invested a lot of money in AI, the apps, the mental health apps, and they're all doing reasonably well. I think it is a hugely positive step because, as you said, a lot of people feel very awkward going to a therapist. Then the whole logistics of organizing an appointment, traveling, going there. So therefore, often these chat-based therapy services can offer a degree of anonymity. It also can give you a lot of explanation for which you need not speak to a person. So because it is algorithm driven, what often happens is that I put in my own symptoms and the algorithm tells you that I have postnatal depression. I very recently met a woman who was deeply ashamed at not feeling happy after she had her first son was born. And then she Googled and then she was taken to a chatbot. From there, she realized that she was actually having postnatal depression and she wasn't a bad mother because she wasn't feeling happy. So, see, there are numerous such examples, and if we kind of create a pyramid of the needs, the mental health needs, AI driven apps can possibly satisfy a large number of healthcare needs and give it to people who are not getting it. Obviously, it will not cater for everyone because of the logistical reasons, because of the human emotion contact, but I think it has to be integrated and we really cannot just dismiss it because often information itself is very, very helpful, which for you to access me and get that information is a logistical challenge. So I can get it very reliable information from the app.
But are there concerns around data and privacy? So for instance, if I'm talking to a human therapist, then I am consciously sharing only what I want to share. But if there is an AI therapist which perhaps has access to my Instagram usage, it perhaps has access to how many kilometers I walk in a day, there's a lot of unconscious sharing that is happening. So consent, privacy, how does that factor in?
True, that is, Priyam, that's a very valid question, and we really haven't explored the problematic boundaries, but definitely how. So, suppose I work for Google, or suppose I have applied for a job in Google, and my manager finds out that I have used a chatbot, and which Google has helped to design, and then my manager might find out that I'm a racist or I'm I don't know, a redneck American who hates the blacks, and therefore a lot of my angst was driven from that part of. So I think we really haven't explored that part, but that is a genuine concern, and we know now for a certain that a certain fact that you are given jobs given depending on your social media profile. Even in Kolkata, very recently, a couple of years ago, a teacher was sacked because she was seen drinking in a pub uh, in her private time, and there was a lot of furor about that. So, how these will play out, how this big data can be, because I'm divulging my deepest, darkest secrets. I use Bard a lot, Gemini, which is now Gemini. And I don't know if any of you use it. Right at the beginning, they would give you a warning that don't ask questions which are sensitive because we collect data. And I assume that they are warning me so that I should not ask anything which is very, very sensitive. Like, and again, I will give you an example. Very recently, I was trying to find a kind of a caption for a friend who was putting it up on his Instagram regarding a shooting of a film. So I said, can you give a caption which reflects that I'm missing the shooting. So Gemini said, please contact the helpline. We don't encourage rifle shooting, mass shooting. You need to. So I said, no, it's not mass shooting or anything of that kind. It's just a film shoot. And then they gave me a fabulous caption, which my friend plagiarized and got about 7,000 likes. So I'm still holding him to that because, but I think the boundaries of data breach is very, very real, and it has happened to all celebrities, stars, and even the so-called iPhone. Their iCloud data was hacked about 7 or 10 years ago.
Before I proceed to the next question, let us get a pulse of the room. Assuming you have access to a human therapist, as well as an AI therapist who you know is competent, who is reliable, how many of you would prefer an AI therapist over a human therapist? How many in the AI camp? Just two. Just two? Okay. All right. Okay, maybe there's a reluctant third hand over there. But move to Dr. Rajodhri. Specifically with respect to pulmonology, it's an area where there's a lot of data through wearable devices, through monitoring. Tell us how that data actually leads to differences in treatments, in diagnoses, be it something as common as asthma or maybe even more complicated illnesses and diseases.
Yeah. See, in pulmonology, it has really, really helped. But before I go dive into pulmonology, I just want to first say, with respect to our country, where everything is free, we've actually dealt with more trouble than help. Because what happens is people look at their pulse rate, they just read this oxygen saturations, form a diagnosis of their own, get to the chemist, and the chemist tells them this is your best inhaler that you can use, and then they have a palpitation, arrhythmia, land in the cardiologist's OPD. So that is the biggest problem that we face at the moment with AI in our thing. Where is it helpful? It's helpful in people who've already got diagnosed asthma, COPD, or other diseases where, I have an elderly patient who's just been discharged from hospital, and there are some things called neck pieces which are being available now. Not that, affordable, but that tells you the difference in breathing pattern of a normal person versus when it's becoming abnormal. And whenever they read that, if they get in early touch with their doctor, then that exacerbation gets detected early, it gets treated early, which then results in less hospitalization. Early treatment and less antibiotics, less expenses, and overall less deaths from chronic diseases. Even more than that, younger people who have asthma, whenever they are well, they'll never take their inhalers. And asthma is one disease where you can't cure it, but you can control it completely if you take your inhalers properly. And these devices, somebody say, oh, I'm okay, I'm just going for a run. And then they feel that their breathlessness is increasing. It looks at something called a peak flow meter, which tells you how tight your airways are. And that then prompts them, oh, my airway is tight, let me take my puff-off inhaler. And that then keeps their asthma under control. Again, people who are smokers, and you've all learned about smokers are at higher risk of lung cancer and other diseases. So lung cancer, detecting it early means curing it. And there's a significant proportion of patients who get cured because you can do low-dose CT scan in these high-risk group of patients. So AI can actually detect which low-dose CT scans are actually to be looked at more closely rather than followed up in a year's time. So in our field of work, it's absolutely very, very helpful, but with that big black box warning in our country where everything is free. And the chemist is actually the doctor.
If I may ask you a follow-up, not specific to pulmonology, but in terms of GPs, right? There is a crisis of GPs around the world. But do you think that is one segment where AI can be more useful than others in terms of actually drawing up a patient profile, saving time, saving resources?
Absolutely, very, very helpful, especially where, they are not trained that well, but if AI generated models tell them that this is what the diagnosis would be, but then referring to the, higher skilled specialist, and before referring, giving the treatment that the patient needs rather than wasting the time that goes. Also, GPs and also physicians who work in, second, third tier towns and villages, they can be helped significantly if they have an.
Healthcare is both macro and micro. So when I'm saying macro, we're talking about Ayushman Bharat scheme, Swasthya Satri scheme, and 10 crore population. Now the problem in our country has always been, how do you know how many people are going to fall sick? How do you know how much budget to allocate? We had 800 crores allocated for Swasthya Satri when it started off. Today we are at 2,500 crores allocated for about 10 crore population who know a little bit of hospitalization, would know about 4 in about 1,000 people actually need hospitalization. You do the math, you figure out the actual number required to treat 10 crore people is going to be in excess of 15,000 crores. We have 2,500 crores. Now, this are all mathematics, economic models, but why we don't have the actual data is because we don't know how many hypertensives are there. Where is the prediction? Where is the forecasting? Those models don't exist. Why do we have the data? Each of the hospitals that we have in town, everybody has their own data, but nobody's putting it together even at hospital to hospital level, for us to be able to uh, predict these many people with cardiac diseases are going to be there in my population, these many people are likely to have cancer, these many are diabetics, and therefore can be custom made programs for the entire population, which is happening in Europe. In a lot of European countries, there are public-private partnership models where, okay, hospitals for sure are known, and I kind of hear this often is you guys make money when people fall sick, right? So you're waiting for us to fall sick so that you guys will make money out of it. Well, it is another way to look at it. The other way to look at it is yes, we cure illness, but the actual money, to be honest, is in the prevention. Because if you can prevent people from falling ill, and that's an expensive business to be in, because there's a far more number of healthy people who want to stay healthy than the number of people who are unwell. And therefore, the money allocated, if you do the math, is far bigger industry in wellness than the illness. So, I mean, one needs to, but for that, you need to have data. We need to know the population, predict about it, and develop it. So, to me, AI is going to be very, very powerful. We're at a tipping point of AI in healthcare. From predicting these to developing insurance models to actually delivering care. Sushmita mentioned about pulmonology, cancer. I mean, even now, chemotherapies and immunotherapies are so restricted. You only know maybe 1% of the total genes which are causing a certain type of cancer. We don't. But I am 100% sure the coming decade is going to be transformative, and you're actually going to have, like Dr. Ram said, the gene story. And that's going to unravel in scales which we haven't been able to calculate till now. So that's where. Now, coming to the micro levels, or even at the macro, there's so much of fraud that happens. When we launched a large insurance scheme, you suddenly figure out hundreds of new nursing homes have propped up in the districts, and you suddenly have districts without women, without all hysterectomies happening, and the other side, the appendix is vanishing from the society. Now, that's the concern. So, fraud management in large insurance schemes, which drains about 5 to 10% of the total budget, can be saved in a big way. And this is macroeconomics. And when you come to hospitals, well, there are errors. I was just telling Dr. Ram, most hospitals do not mean to swindle people. They want to do the billing correctly, they want to deliver care in the appropriate manner, but then we have about, 5,000 people working with us across the healthcare facilities, 10 of them. And to monitor each individual, and the human errors are significant. And each error leaves a perception in the population of the patient who's going away unhappy. Now, to my mind, if a lot of this could be prevented, I think that's AI comes in, which would predict the mistake that's going to happen, and we can correct those even before the mistakes happen. The intent is right, but the delivery is where it's getting hurt, and I think AI would be a huge tool for us to improve that.
Now, with the advancement in AI, we've seen a great upsurge in robotics, for instance. We've also seen the requirement for doctors who, quote unquote, are AI literate, who can optimize the use of AI. As somebody who's a veteran of management in this field, does that sort of create a tension when you're looking at doctors, when you're trying to hire them, when you're trying to coordinate, that you now have to look for a specific criterion where doctors are AI literate? And to what extent is that relevant in the industry today?
Robotics is the in thing going forward. And believe me, like we resisted computers when they came in the early days, every time there's a technology change is resisted, but that's the only thing that's constant in our lives. So, and what's very interesting is, guess who's actually adopting robotics? The senior surgeons. Surgeons who are in their late 50s, early 60s, suddenly they discover the joy of robotics. So what happens with age? Your sensory skills go a little numb, right? Your hands vibrate a little more. And you're not so confident doing the same surgery. You're a brilliant surgeon. You've done thousands of surgeries, but that doubt creeps in your mind. What the robot does is nullifies that by 100 times. So even better than when you started off operating. And that gives another 10 years to the surgeon. We have surgeons at our place who said, hang on, youngsters, you come later. It's me, my turn first. And believe me, we do about 100 surgeries a month on a robot. And we're already, within a year's time, our doctors want one more robot to come in. this is the initial phase. And I think as we grow further, there's going to be a lot more of automation and a lot of these things that will, I mean, we've seen it in the car industry, we've seen it in every other industry. I don't see why it won't happen in the healthcare. So the human wisdom, which Dr. Ram mentioned about, is only going to do higher level of work, higher intellectual, and we're going to be using them as a platform, and we do much better quality of work going forward.
My next question is open to the panel. I invite any of you to take it up. There is this idea that's gaining traction increasingly in the world of health and fitness, which revolves around two words: biological immortality. The fact that going forward in the future, if you have the right resources, if you have the right technology, you will not die of natural causes. Your body will not break down. There will be degenerations, there will be dysfunctions that can be detected long in advance. So maybe AI can tell me that based on my eating habits, I'll have a heart attack at 40. So then I start reorienting myself accordingly. To what extent do you think from your fields and your specializations that this is actually something that can happen? Can biological immortality be there as a real possibility, of course, for a certain section of people who are well resourced, or is it something that's just completely speculative, completely idealistic at this point?
This is far above my field, so no, I have some, but I think Sushmita would be. I think cell death, apoptosis cell death is a natural phenomenon, and I really don't understand that how you can prevent cell death through whatever means you employ. I think this is some rich American's fantasy to live forever. I would dread to live forever and kind of hang out with the same set of friends. I don't know who wants to live forever, but I have a feeling this is, a biological impossibility given the boundaries of our knowledge at this point in time. I know it has gained a lot of traction recently over social media because there's one guy who is wanting to live forever. But how can you prevent cell death? I don't know.
No, I don't think. I think it's entirely speculative at the moment. If you think of anything that is natural, everything has an expiration date. At the moment, what they're trying to see is whether that expiration date can be lengthened or not. And now in this process, the body is never 2 plus 2 is 4. It's made of certain number of organs, and each organ has its own age. Not everybody grays early. Okay? Not everybody becomes fat in spite of eating whatever they do or whatever little exercise they do. So each body is different from the other. And that is because each body has a different mechanism to operate given the circumstances and the environment that they are sent into the world and the genetics that they carry. Yes, if somebody is able to change the entire genetics of the human body, which might happen, maybe I'm not saying it won't, many years from now would be possible. But at least in the next 20, 30 years, I don't see you're going to be achieving biological immortality. You might have lengthening of your lifespan at a very high cost. That is definitely possible.
No, I was just wondering the economic cost of keeping 11 employees up. So no comments here.
So the bottom line is all of us in this room are going to die, in case you didn't know that already. My final question before I open it up to the audience is, are there any no-go areas when it comes to AI and healthcare? It could be from your specific fields, it could be from what you anticipate about other fields. Where do you think, given the advancement AI has reached so far, you would rather it not go ahead and get involved in this sector or that aspect of healthcare?
I'll just start from my sector, yeah, because I deal with a lot of elderly people with end-stage diseases. And from what I can see, whenever something like new comes, people just try to keep people alive. What we are completely missing now is the compassion part in treating a human being, knowing what they want. So when I was doing my membership in the Royal College, everyone failed on one station because there was this girl who came and she had diabetes, and we were asked to tell her that she didn't want to take insulin, and we were asked to convince her to take insulin. And everyone went and said, it's good for you, you will live, otherwise, you'll have a heart attack, you'll die, etc., etc. Fine, I won't take it. Only one person passed. And who was that? It was the person who asked, why won't you take it? And that's when she said, I'm scared of injections. So he just sorted it straight away, saying, well, I'll give you something. That's not an injection. She said, fine, I'll take it. Similarly, we have patients who don't want to be treated. So knowing where they want to be treated in people who have a certain number of years left and just want to have a palliative care option available to them, going head and deep in with technology, I don't think is the right thing. Knowing that, knowing the patient's wishes and helping them the best is what I think should be done.
For me, as you already mentioned, data privacy is a very, very major issue. Because often people come and say very, very personal things and how it can be potentially misused and sold off. I don't know whether all of you know that majority of the large corporate hospitals, they have contracts with all the big data companies exchanging data. And in our hospital, only my prescriptions are not scanned because there's a lot of sensitive, and I had to fight for it. So there is this genuine concern about if I write something about an individual and if that data gets uploaded, then who gets to see that data? Those are very genuine concerns, at least from the field of mental health.
No, for one, we don't have tie-ups with any clinical trial companies just now. No, but yes, that's
You're
true.
missing
And
out.
the concern is genuine, and I understand where
No,
you're
you're
coming
missing
from.
out on huge amounts of big bucks.
Yeah, we all make choices. No, but honestly, I will look at it differently. I would think the opportunities of AI are such limitless, and the impact that it can have in delivering healthcare in a efficient, affordable, and much more, which can make a huge difference. And to me, the negatives are something probably we shouldn't be bothered about, but the impact on healthcare is going to be phenomenal of AI, and we're at the tipping point.
We're now open for questions. If you've got a question, please raise your hand and the mic will find you. I think at the back.
Everyone, I'm Aryaman from St. Xavier's College, and I would like to ask a question about AI in health on the micro level. So, there are times when we are suffering from some health complication or a symptom, and we usually tend to go to the internet and search it up over there, because I think internet to some extent has been a form of precursor to artificial intelligence. So therefore, can there be some sort of AI technology which can help a common individual like me to figure out what exactly am I facing? Can diagnose what exactly am I going through? Because anytime we kind of go through internet, we kind of get a lot of bizarre things that, it's not a stomachache and you're probably about to die in 5 minutes. So can there be something like that?
Of AI-based apps where people, like you, who are intelligent, know their symptoms, put it on. It's choosing the right app, which is important. And even more than that, might be good to know a friendly doctor nearby. It's better to discuss with them and let them decide. Otherwise, the amount of anxiety people suffer from, where, when they've got a diagnosis in their mind, which might be far from what they have. It might just be a viral bug, which has left a cough behind, but you come out with a diagnosis from, a Google-based app, which tells you have tuberculosis, right? So it's always better in today's day and time to know a friendly doctor nearby, go discuss with them, and if there's anything necessary, then do it. Rather than have a, app-based diagnosis first and then go to doctor. You'll be surprised to know that at least 5 patients a day come with the kind of symptoms that you do. And out of those 5, rarely there'll be one person who I might need to order an investigation for.
I think this phenomenon of health anxiety has increased a lot because of Google and internet, searching the internet. And we do all see a lot of increased health anxiety. I wanted to share a kind of a sad and a funny story. This is slightly on the out of the. I once saw a girl who was in class 10 and she decided to kill herself. She's still living. She is now mother of 2 children and she's doing very well. So what happened? She Googled about 15 years ago what she can take for overdose to kill herself, and then made a list of all the medicines, wrote it down, and took them to the friendly neighborhood chemist. And he realized that these were all US based brand names and immediately called the dad and said, so she told this girl that, oh, these are this list of medicines and I have to order, I have to get, so why don't you go home? I will get all these and call you back. And so then this guy Googled and realized that these are all medicines for overdose sedatives. And so this is, in fact, she regrets using, say that it was one of the bad mistakes because that is how she met me. And she said that I'm still having to meet you after 15 years of my life. So, but I think often it gives very false information, which causes a great deal of anxiety, particularly cancer, the fear of cancer, because end of the day, somewhere down the road it is mentioned in these internet stuff. So therefore, I think one must be very, very wary using it as a port of first call. There was another question.
My name is Zaina, and I had a question that with time that there are these chatbots, especially where you can talk to a psychologist online. So, do you think with time people would be more open to using these online algorithm-based psychologists because they are hesitant to approach one in real life, or because these are free rather than actually paying to have to go to a psychologist?
Not all. Suppose if you have 20 people contacting these chatbots, out of which I hope that about 7 to 10 of their problems will be solved by just getting the information and getting some baseline tips from the chatbot. So it does help a large majority of people who find accessing healthcare difficult for a variety of reasons. So I think it is genuinely a good move, and the number of adolescents who use and young people who use chatbots and stuff is actually quite surprising. And they are usually mostly of fairly decent quality, because I have personally used something to see whether how it leads me into one path or the other, and they are fairly reliable.
I think the most important part for all of you to take is, unless an app is validated, using it just because it's available is how lots of you here use Instagram and Facebook. There are things like name tests and stuff like that. This app will tell you what is, say, Zaina like, and then that app's going to give you, Zaina is hardworking, she's the best thing that happened to Mother Earth, and you will say, oh yes, that's me, because that makes you feel good. And is that really true? You really don't know. So unless an app is validated, try not depending on it. At the moment, people who've spent 20, 25 years trying to study about the disease, knowing about it, discussing with them might be a much better option. But initially, yes, as he said, it might be a good option to go to it, find if there's a problem, and then go and see someone who really knows about the condition.
Yeah, my question is that when we are talking about AI, so patients nowadays search in Google with the keywords, I have a heart attack or something like that. So when also, as you are talking, that AI has the database of 5,000 X-rays and everything. So sometimes also doctors also fails to diagnose something. So AI also have the problem of doing it. If I have to do telemedicine, if I have to go to, suppose in Assam, I have to go to the rural field and I have a telemedicine over there. There can be also a failure of AI also with the database.
About a million such cases having done. So chances of anybody can fail, you're right. Everything a machine or a human being can fail, but then the chances of making the mistake is that much more reduced. And like Dr. Smita said, it's always good to take a second opinion. And the chances of failure goes down by half, even reduced by that. See, what it helps is even today, my mother had a cardiac issue this morning, and first thing I did was Google. Now, I read about arterial defibrillation and then we exchange notes. Now, what it helped me is I've been into healthcare for 25 years, but I have zero idea of what it that was beyond the point. My cardiologist knows the best. But to have a meaningful conversation with my cardiologist, I read up. And therefore, the conversation, two, it was more meaningful. And three, it took only half the time I would have otherwise asked 100 more questions. And in today's world, where time is a most precious resource, it helps. But yes, one has to be using their own intellect. You can't leave that behind.
Thank you. I think we have time for one final question, if there's one. In summary, it is fair to say that when it comes to healthcare, AI is increasingly equipped to handle the health aspect of it. But when it comes to the care aspect of it, it is still very much human and creative intelligence that remains at the forefront. Thank you so much to all our panelists, and I'll hand over proceedings to now.
Good health always starts with healthy conversations. Sometimes with the chatbot, preferably at least the second time around with a licensed professional. Yes? Yes? Okay. All right. On that note, I think we can do better with the applause. And thank you. And it's time for the formal photographs for the panelists and for the
Mahadeva